Disclaimer: this story serves as an example and is fictional. According to studies, mothers can experience not only positive feelings, but also phases of insecurity and inner turmoil, or even distinctive psychological discomfort at any time during pregnancy or in the first weeks after giving birth. Sarah is one of the 50 to 80% of mothers who experience emotional ups and downs in the first few days after giving birth. On the one hand, she is exhausted, extremely sensitive and irritable. On the other hand, she has a strong feeling of gratitude and deep joy. These are typical symptoms of baby blues, which does not require treatment, since the symptoms of baby blues can be triggered by normal hormonal fluctuations. It usually lasts 3 to 5 days and no longer than 2 weeks. However, if the symptoms persist, it can develop into peripartum depression, as it did for Enos. In fact, Enos experiences similar feelings as Sarah, which occurs shortly after delivery and lasts for 2 weeks or longer. She feels so overwhelmed and fatigued that she has trouble getting up from the sofa when her child cries. She thinks that she cannot fulfill the needs of her child. Therefore, she suffers from feelings of guilt and thinks that she will always be a bad mother. In general, nothing really brings her joy anymore. She cannot even be happy about the birth of her child. In addition, she does not feel connected to her child. Physical contact seems uncomfortable for her, so she avoids breastfeeding and cuddling as much as possible. Sometimes she thinks her child would be better off if she wasn't around. She is ashamed of herself around other mothers and around her family because she does not want to be perceived as a bad mother. Enos experiences typical symptoms of peripartum depression. The symptoms begin either during pregnancy or within the first 4 to 6 weeks after delivery. The symptomatology resembles depressive episodes that occur independent of pregnancy. For a diagnosis according to ICD-11, at least 5 symptoms, including at least depressive mood and/or loss of interest or pleasure, must be present for at least 2 weeks, which are accompanied by several other symptoms. A distinctive feature of peripartum depression is that symptoms revolve around the child and the new maternal role. There may also be excessive worry and anxiety concerning the child's well-being, obsessive thoughts and impulses of harming the child, or panic attacks. Recent studies show that the other parent might also develop depression symptoms during this period. Unfortunately, this aspect is insufficiently taken into account in the care system. In this context, both maternal depression and that of the partner can have detrimental effects on the baby's development. In general, psychotherapy is recommended for the treatment of peripartum depression. Especially mothers at high risk for depression, for example, mothers with mild depressive symptoms during pregnancy or previous depressive episodes, are encouraged to undergo psychotherapy to prevent peripartum depression. Mothers who are taking psychotropic medications due to pre-existing diseases with a severe course should consult their psychiatrist to adjust their treatment. For those mothers who develop a severe peripartum disease, the benefits and risks of drug treatment should be weighed up with the psychiatrist.